Think about how frustrating it is to live with borderline personality disorder. The distress that comes with your intense mood swings, or the frantic feeling of being abandoned, the chaotic relationships with people, and the erratic and sometimes risky behaviors. Also, think about the anger, irritability, verbal aggression, and sometimes even the physical altercations you have. The suicidal thoughts and attempts, that chronic feeling of emptiness, and feeling like no one understands you, especially when they say they're walking on eggshells around you. But it doesn't have to be this way. You don't have to continue to struggle and feel hopeless. We know that borderline personality disorder involves a rigid and unhealthy pattern of thinking and behaving, but what if you could get to the point where you felt in better control of yourself, your mood improved, and you stopped self-harming and sabotaging your relationships? So let's talk about how to treat borderline personality disorder. I'll talk about 3 ways to treat this condition. The first is psychotherapy. This is the treatment of choice, but for best results, you need to add the other 2 components, which I'll discuss in a bit. So let's start with psychotherapy. There are 3 evidence-based therapies that can help with borderline personality disorder. The first is known as dialectical behavior therapy, DBT. It combines mindfulness practices with skills to regulate emotions and relate to others. DBT is very helpful if you have suicidal thoughts or behaviors. A second type of therapy for borderline personality disorder is called mentalization-based therapy, MBT. This type of therapy helps you manage the roller coaster of emotions you struggle with. It enables you to feel understood and helps you understand the intentions of people around you. The third type of therapy is transference-focused psychotherapy, TFP. This therapy focuses on using the relationship with your therapist to develop your awareness of interacting with others. Therapy sessions for borderline personality disorder can be individual or group sessions. In a lot of cases, you may need to be in therapy for 12 to 18 months or even longer. Which of these therapies is best for you? Well, studies show that all 3 are helpful and show varying degrees of success. Currently, there is no consensus as to which of these is superior. So therapy is the first choice for borderline personality disorder, but you need a combined treatment for the best results. The second way to treat borderline personality disorder is by adding medications to your treatment. Note, however, that there are no approved medications for treating borderline personality disorder. Medications, when prescribed, may be helpful with specific personality features you may be struggling with. Antipsychotic medications may help you control your anger, hostility, paranoia, and hallucinations. They can also help stabilize your mood. Antidepressants like SSRIs may help you with your depressed mood and also anxiety. Benzodiazepines like Xanax can sometimes help with anxiety, but this medication has also been shown to make some people feel worse. Mood stabilizers like Lamictal and carbamazepine can help stabilize your mood and improve overall functioning. Self-harm behaviors, boundary issues, and frequent suicidal threats can be challenging to manage. High rates of alcohol and drug use in borderline personality disorder can also make treatment harder. Admission to a psychiatric hospital is not typical if you struggle with borderline personality disorder. You may, however, require hospitalization in certain situations, such as feeling suicidal with intent and plan, or if you have stressful events worsening your symptoms. Also, admission to a hospital may be necessary if your self-harm behaviors begin to worsen, or if your other mental disorders like depression, bipolar disorder, or drug use spiral out of control. Besides therapy and medications for treating borderline personality disorder, the last point to consider is applying the various tenets of lifestyle medicine. These are exercise, nutrition, sleep, stress management, social connectedness, and avoiding risky substances. I'll talk about this in more detail in a later video. Even though borderline personality disorder can be frustrating to live with, getting the proper treatment can improve the quality of your life. Please note that this is not medical advice. It is for information only. If you have borderline personality disorder, reach out to your therapist or psychiatrist and attend the nearest emergency room if you have suicidal or homicidal ideations. My name is Dr. Air, board-certified psychiatrist and lifestyle medicine physician. Thanks for listening, and please share this video to help others. I'll speak with you soon.